How can veterans obtain a service dog for PTSD? Veterans often wonder how they can obtain a service dog to help manage their post-traumatic stress disorder. The process involves several important steps that ensure the veteran's needs are met and that the service dog is properly trained. First, it is crucial for veterans to have a formal diagnosis of PTSD. They should also be actively engaged in ongoing mental health care, typically for at least 1 year before applying for a service dog. This ongoing treatment helps ensure that the veteran is stable and ready for the responsibilities that come with having a service dog. Next, veterans should consult with a healthcare provider. This could be a mental health professional within the Department of Veterans Affairs or another qualified clinician. During this consultation, the veteran can discuss their PTSD symptoms and any functional limitations they may have. The provider will assess whether a service dog would be a suitable addition to their treatment plan and help outline specific needs and goals for the dog's assistance. If eligible, veterans can apply for benefits related to service dogs through the VA. While the VA does not directly provide service dogs, it may cover certain costs once the dog is obtained from an accredited organization. This can include veterinary care, specialized equipment, and travel support. The application process involves a thorough review by a prescribing clinician who will evaluate the veteran's ability to care for the dog and whether other therapies might be more appropriate. Veterans can obtain service dogs through accredited organizations that specialize in training dogs for PTSD and other disabilities. Alternatively, they may choose to work with private trainers or even train their own dogs. It is important that the dogs are trained to perform specific tasks that help mitigate the veteran's PTSD symptoms. The Americans with Disabilities Act protects the rights of veterans to use service dogs, regardless of how the dog was obtained. Once a veteran has a service dog, the dog must be trained to assist with PTSD-related challenges. This could include tasks like interrupting anxiety or panic attacks, providing grounding during flashbacks, or creating a safe personal space. Veterans typically need to demonstrate that their dog has successfully completed training through certification from the accredited organization. This certification is also necessary to access VA veterinary health benefits for the dog. After obtaining a certified service dog, veterans can access veterinary care and equipment support through the VA. However, routine expenses like food, grooming, and boarding are usually the responsibility of the veteran. The VA also offers travel support for veterans with service dogs when attending medical appointments. It is essential for veterans to have the ability and means to care for their service dog, including support from family or caregivers if needed. Service dogs are not a replacement for standard medical or psychological treatments for PTSD but serve as a complementary support tool. The process can vary based on individual circumstances, and each case is reviewed on its own merits by VA clinicians or service dog organizations. In summary, veterans can obtain a service dog for PTSD by confirming their diagnosis, engaging in ongoing mental health care, consulting with healthcare providers, applying for VA benefits if eligible, working with accredited organizations or trainers, completing required training and certification, and accessing VA veterinary benefits for their dog's health needs. This structured approach helps ensure that service dogs are integrated effectively into the veteran's overall treatment plan.